8-foot bypass.
8 foot. Yep.
We're going for the gold ring. Nothing else special to tell you. You know, anesthesia went smoothly, and there was nothing unusual, nothing bad.
Good. I have to say that one of the things that scared me the most was the pain factor, because I've had previous surgeries, the last surgery being hernia repair and a tubal ligation at the same time, and I was in an incredible amount of pain, and I'm going into this thinking, okay, he doesn't really like to use narcotics, like we don't get really any pain medication after the surgery. Oh my God, what am I going to do? I have no pain. And it's out of the box thinking, and I love that. This whole process is really out of the box, and I'm really taken by that, because there's a camaraderie among all of us.
Now, let me interrupt there, and I apologize because I interrupt my patients all the time.
That's okay.
And I apologize. But now this is the morning after. I threw you all together, okay? I threw you all together. You didn't know each other yesterday, but having everybody last night to be able to look over and ask them, whatever. It really makes a difference, we think. I mean, we had to drag you into that first clinic on Tuesday, and you had to see all those other people, but we find and we hear that patients, you know, they look at somebody else, they know somebody else been through exactly the same thing, and it makes a huge difference. So,
surely
very
it does.
excited about that.
And one thing that I, was, as they were taking care of me through the night, is my blood pressure kind of stayed high, like 150s over 160s, 150s over 90s.
Yeah,
so,
let's talk about that.
On my baseline, wasn't high, so I just was curious about that.
Yeah, that's part of the stress response.
Okay.
In other words, you first of all bring the baggage of being an overweight person.
Yeah.
And that means that many of you are on your way to high blood pressure, diabetes, sleep apnea. Some of you are already there. You're already arrived at that. But just like, when you get pregnant, you can have some women who are not diabetic become diabetic with the pregnancy. Okay? That's kind of a warning that later in life they may be facing the risks and problems. So the fact that during your stress response we see high blood pressure, we didn't measure your sugars, but if we measure them, we might find some of you are high in your blood sugars. This is a premonition of things to come.
Mm-hmm.
And it's also a demonstration that maybe, was this really a good idea to do the surgery in the first place? And the answer is, maybe in your future was high blood pressure. Maybe in your future was sleep apnea and low oxygen. We see in a lot of our patients things like that. And what we're saying is, those signs are about to be erased. We're going to change your path in your future. And so high blood pressure, and maybe diabetes, and maybe cancer and heart disease and things like that are going to be things that you're going to turn away from and go down a healthier path.
Right.
Yeah.
And that's my goal, the healthy path.
Mm-hmm.
And other than that, everything, I feel great. I can move, I can...
I'm sorry, what'd you say?
Everything feels great. And I don't have any pain. I have, the gas...
I think you can say that. What do you say, one more time?
Everything went great!
I can see that now. That's the video for my... When the web page opens, hi, everything feels great.
When you go in expecting one thing and you come out and it's a totally different picture, it just makes your whole it makes the whole thing, and tells me that I know I made the right decision, and I'm so happy to be here with the rest of the group. Everybody's just wonderful, and that connection is just really special. So, and Dr. Rutledge, you did a wonderful job. Thank you.
It is time. I think it's appropriate to take a moment and give thanks. I mean, I do think that we face risks in the surgery, and terrible complications can happen.
Yep.
And everything went great, and we're really happy. Everybody's done well, and so.
And my pouch is small.
God. And you have a tight, narrow pouch. Yeah. Well, have you had anything to eat today?
I've just been fluids, just drink. And I had yogurt.
Have 10 crackers, and you'll see.
Okay. I don't want to I don't want to...
I'm just kidding, because you don't want to do that.
No.
Let me tell you, it's tiny.
Thank you.
Yeah. You got a nice small pouch. You're going to have a massive weight loss. Questions? Anything that we need to answer for you?
No, I think the blood pressure was a question. Swimming 10 days?
Yeah, what's the idea? You know this, but just for everyone, why can you shower but not swim? And the idea is you've got a cut. We don't want bad stuff to come from outside to inside. So until this is completely healed, we take the staple out. We say don't be underwater in a bathtub or a swimming pool for 7 to 10 days until that's completely sealed.
Got it.
A little shower is fine, and it's probably okay to swim, but the thing is, if you were there for a long time, maybe it would open up enough so something outside could get in, and then you got an infection,
Yeah,
you got big
that's-
trouble.
yeah,
So
no
don't do it.
infections. Rather be safe than
You
sorry.
can sit by the pool, but not get in the pool.
Okay. I can dangle my feet. My feet.
Dangle? Yeah,
Okay.
yeah. No problem with dangling.
Okay. I have no other real questions or
Okay,
everybody's
everybody
been very
applause.
thorough. Yay!
All right, good.